Why is metabolic health particularly important after, say, 65?
What we call it insulin resistance.
Are healthcare professionals seeing more cases of diabetes and pre-diabetes?
In the US, there are some studies showed that 1 in every 5 would have diabetes.
How can telehealth help older adults to stay engaged with preventative care and monitoring?
I think patients' life easier and doctors' life easier.
When healthcare providers look at diabetes risk,
Sedentary lifestyle.
seniors who may be overwhelmed by all these health recommendations,
Start simple physical activity.
what is a Medicare annual wellness visit and how does it differ from a traditional medical appointment?
The goal of these visits is not to manage diseases. It would be like a checkup.
Hello everyone and welcome to the very first episode of the MedCare podcast, where we talk about simple ways to live healthier, longer lives. MedCare provides telehealth support and educational resources focused on helping seniors stay informed about preventative care and connect with healthcare providers from the comfort of their homes. Today's episode is called Diabetes and Metabolic Health After 65, What to Track and Practical Prevention. Joining me today is Dr. Hesham, who will share general insights about metabolic health and aging. Dr. Hesham, welcome to the show.
Thank you for inviting me, and that's a great opportunity to educate people about metabolic health.
Lovely to have you here. Dr. Hesham, to start off, could you tell our listeners a little bit about your medical background and the type of patients that you typically work with?
I'm a consultant endocrinologist and internal medicine. Actually, I see different categories of patients, but of course, people at age of 60 and above, it's my interest to improve their lifestyle.
Okay. And what led you to develop an interest in metabolic health specifically and chronic disease prevention?
I believe 3 main reasons. The first reason that chronic metabolic diseases affect the quality of life. A second reason, largely those medical problems are preventable and manageable. And the third reason, I believe, proactive strategies can be taken to improve the lifestyle, and that can be done through simple advice, including nutritional advice, physical activity advice, and that would impact positively on the lifestyle and the quality of life in general.
So that is where education is key.
Yes.
People get older, their health priorities often change, but from a medical perspective, why is metabolic health particularly important after, say, 65?
I believe there are many changes would happen after age of 65. For example, what we call it insulin resistance, how our body deal with glucose. Glucose, we know it's a source of energy. It's very important for the brain and for the body to keep functioning. Then insulin resistance means the response of the cells in our body to the glucose, how to utilize glucose would be affected. And that's a very important point at age of 65. Secondly, the problem with the muscle mass. Then at age of 65, people tend to lose their muscle bulk. And we have studies showed maybe after age of 45 or 50, we lose around 1 to 2% of our muscle bulk every decade. And that's also a very important point because muscle mass or muscle tissues, very important to utilize glucose. If you have less muscle, then your body wouldn't utilize glucose efficiently. And these are, I think, main reasons, besides, of course, tendency to store fat will be more at age of 55 to 60. Those are reasons will increase the risk of metabolic diseases in general.
Okay, and does your metabolism tend to change over time as you get older?
It slows. Because of these reasons that I said, the metabolism slows over time. And that's why we need to have some strategies to keep those chronic diseases away.
So are healthcare professionals seeing more cases of diabetes and pre-diabetes in older adults today compared to previous years? Is it new?
Unfortunately, despite of that, improvement in the healthcare systems everywhere in the world, but we still see increased number of people with metabolic disorder, specifically diabetes. If you compare to 1990, for example, we have double numbers of people with diabetes.
Wow.
In the US, there are some studies showed that 1 in every 5 would have diabetes. 1 in every 2, half of the population may have a pre-diabetes.
Gosh.
It's very important point to focus on, and probably population aging also, it's a reason. The second point also, we are screening more. And that's a good point to, know those people having pre-diabetes, to try starting, taking action to improve the metabolic health. Yes, we see, unfortunately, more patients these
And
days.
do you think some people assume that maybe a slightly elevated blood sugar is simply a normal part of aging? Are people normalizing
Again,
it?
unfortunately, people think, okay, now I'm 70 years old. It's okay to have, for example, HbA1c. I will talk about that, which is the average of blood glucose. It's okay to have it 6%. 6% means this is a pre-diabetes range. We have many studies showed the risk of having heart disease, what we call it cardiovascular disease, it's around double in people with pre-diabetes. And pre-diabetes is a silent disease. You will never know that you have pre-diabetes unless if you check your blood sugar.
So the symptoms aren't always obvious?
Those are what we call them silent killers. Like high blood pressure, hypertension, hyperlipidemia, high cholesterol and triglyceride, and diabetes. You will have symptoms when you have a very high blood sugar.
Right.
But at the early stages, screening is the best to do.
It hides itself very cleverly.
Yes.
So before we continue, I want to remind listeners that everyone's health situation is different. So the information shared today should be considered general educational advice rather than personal medical advice. Dr. Hashim, when healthcare providers look at diabetes risk, what are some common risk factors that they evaluate in older adults?
That's a good question. Sedentary lifestyle first.
Okay.
Then,
keep moving.
Now, yes, desk job, office job. Unfortunately, most of the people do this. And that's a major risk factor for developing metabolic disorder, including diabetes.
Okay.
Second one, I think, obesity. These days, we see people carrying lots of fat, and that is an excess fat. And the distribution of fat wouldn't be good because we have something called visceral fat, fat inside the body, not in the store, around the liver, for example, and around the pancreas and other organs. I think this is another risk factor. Third risk factor, we can discuss about family history. Then if you have a family history, because part of that might be genetic, and if you have a family history of diabetes, then please check your blood sugar. Then I believe those are the major risk factor to develop diabetes.
Okay. And for individuals who've not been diagnosed, what are the general warning signs that may prompt someone to speak to their physician?
As I said before, I would prefer screening.
Okay.
Go if you have a sedentary lifestyle, if you have a family history of diabetes, if you are overweight, go and check your blood sugar. Don't wait for the symptoms. But if you talk about the symptoms, if you have a high blood sugar, that would lead to few symptoms like frequent urination. You go to the toilet frequently to pass urine. Secondly, you feel thirsty, dry mouth, and you start feeling fatigue, tired, brain fog. Then these symptoms related to increase the blood sugar, but that's a significant increase of the blood sugar.
Okay.
Then don't wait for those symptoms to happen to visit your doctor. Try to discover diabetes in early stages to avoid reaching this point. But those symptoms are treatable. I mean, if you lower the blood sugar by the management led by the healthcare provider, those symptoms will disappear.
So that everything can be managed and reversed if you catch it early enough. Is that what?
This is a very good point. We consider diabetes these days as a reversible disease.
Well, that's great to hear.
Yeah, before we thought it's okay. If you have diabetes, you live with diabetes, for life. But if you discover diabetes in early stages, and hopefully before age of 65, and we try to screen, then yes, it might be reversible. And if you maintain a healthy lifestyle, you may maintain the blood sugar with a normal ranges.
Okay, so the term pre-diabetes, explain that to a non-medical person.
Okay.
Me.
Yes. Now, to start with, I think before pre-diabetes, what we have, what we call it insulin resistance.
Okay.
The response of the cells to utilize the glucose would be different. It's a bit blunt.
Yeah.
Then the second step, the pancreas will start to overcome this problem by producing more and more insulin to
Okay.
get the glucose inside the cells to be used as energy. Now the pancreas started to be tired.
Okay.
That exhaustion of the pancreas will go to the second step where the blood sugar goes a little bit higher than usual. And the pre-diabetes, by definition, if you have a fasting blood glucose between 100 and 126 milligram per deciliter, this is the fasting blood glucose.
That's a blood test.
The blood test.
Okay.
100 to 126 milligram per deciliter. This is pre-diabetes. This is not normal.
Okay.
Now, if you have HbA1c, what's that test? It's very important test. It's an average of blood glucose in the red cells. That tells you what's the average of blood glucose in the previous 3 months.
Okay.
Then if you do it once now, we'll give you, okay, what about the blood sugar over the 3 months? If your HbA1c more than 5.7, it's pre-diabetes.
Okay.
If it is above 6.5, it's diabetes.
Diabetes.
Then I think our goal to discover pre-diabetes before going to diabetes,
Okay.
because that can be reversed easily before develop to diabetes.
So that can be reversed with lifestyle changes. Is that what you're saying?
Mainly. Now, losing weight is very important. If you get rid of the extra fat mass, it's very important. If you improve your lifestyle in terms of the physical activity, stress management, sleeping better, having a healthy nutritional plan, yes. But also sometimes we use medication if the lifestyle measures don't do the job.
Okay. When pre-diabetes is identified, what types of lifestyle discussions typically happen between patients and their healthcare provider?
That's a very important point, actually, because with the chronic diseases, self-management is very important.
Okay.
Then we need to educate people how to live, day to day. Now, first of all, we should avoid sugar spikes. And that mainly happen with unhealthy food, like ultra-processed food, refined sugar, refined carbohydrate, refined grains. We should avoid that. We should tell people, please eat real food.
Okay.
Okay? And try to probably start with a protein intake, start with vegetables, high fiber diet, and you can add carbohydrate. Carbohydrate is still important, but we should avoid the simple carbohydrate that spikes the blood sugar. First. Secondly, physical activity. If you don't do anything, start walking half an hour a day.
Okay.
Brisk walking, probably.
Just
specifically
start.
after meals, yes. Because I can't ask you to go to the gym for 2 hours if you do nothing today.
No.
Okay, then you can't manage that. Then try to walk half an hour daily, increase that to 1 hour, count your steps, but at least walk after meals, specifically this heavy meal. If you
Okay.
walk half an hour after meal, that helps in reducing the blood sugar. Okay? Now, stress management. Stress increases blood sugar. We need to also to counsel somebody to help us in stress management. Sleep. If you don't sleep well, your blood sugar will be
Is that
up.
right?
Of course. Very important points to focus on while we counsel our patients about the lifestyle. And as I said, those are the cornerstones of diabetes management.
Okay. And for seniors who may have difficulty attending in-person visits, how can telehealth help them to discuss these risk factors and prevention strategies?
See, it's very important. Education can be done virtually, easily, specifically with those chronic diseases. If you have a nice discussion with my patient about how to change the lifestyle, as I said, including the eating habits, physical activity, stress, sleep, and we can also get help from other healthcare providers like nutritionists, for example, exercise physiologists, stress management specialists. And that's very important. That doesn't require, traveling miles to come to the clinic to sit in front of me in the office and discuss these things. We can do that virtually, sometimes through the phone call or video call. Yeah, it's very important to educate people that can be done virtually.
So once they've got their blood results, most of it can be done remotely?
Yes.
Okay.
Yes, it's very easy because that's, I have the blood test result. Hopefully the patient also will have the copy of that result. And we can go through this step by step. And I can explain to my patients how, we interpret these results and what we expect in 3 months or 6 months with a follow-up visit in terms of the improvement of these markers. Yes, that can be done virtually.
A physician can easily support somebody trying to make these lifestyle adjustments remotely once they've got the data.
Absolutely.
Well, that's really great. So for seniors who may be overwhelmed by all these health recommendations because they come thick and fast from everywhere, what is one small habit that a healthcare professional like you would suggest that is their starting point?
Start simple physical activity.
Just moving.
Simple physical, just move, That's very important. It depends on where are you now, okay? As I said, if your lifestyle is very sedentary lifestyle, start to change that in small steps. I don't expect you to run a marathon in 3 months or 6 months, correct? Then start to do that small steps, and that would make a significant difference in a year from now. Then don't be hesitant to start that from now. And that, of course, required motivation. Yeah. That's why talking to your healthcare provider is very important to discuss, okay, how I can do that. Because people will be frustrated at some stage. They may walk half an hour and blood sugar is not well controlled. I'm frustrated. No, everybody is different. There's no one size fits all in metabolic disorders. Then we need to tailor a plan, depends on the circumstances of every patient. But I would say walk for half an hour a day. Brisk walking, this is what you should start doing today.
Okay, I have a question. Is it half an hour in one block, or could it be, if you're really starting from nothing, it could be 3 lots of 10 minutes?
Yes, I agree with that.
So it could be a very, very small start, but that you just build up gradually.
And let's do it after meals, for example.
Yes.
If you have a meal, just try to walk 10 minutes, 15 minutes, which is fantastic. And you can walk a normal walk today. Tomorrow you can do it a little bit brisk walking. After that, if you work, for example, use stairs rather than using the lift. Try to be active in a different ways. And I always say, if you want to follow a lifestyle, that lifestyle should be sustainable lifestyle.
Yes.
Enjoyable lifestyle, doable lifestyle. Not a lifestyle that perfect. There's no perfect lifestyle.
No.
You need to tailor that, depends on your own circumstances.
Yes. There are many health numbers that people hear about when discussing metabolic health. But from a general perspective, for people who are not medically qualified, like me, what are some key health indicators that healthcare providers often monitor in older adults?
There are something can be done in the office, not virtually, like checking the blood pressure, for example. Mm-hmm. That's very important to check blood pressure. Again, that's a silent problem. If you don't check your blood pressure, you will not feel it. Yeah. Then if it's a little bit high, and if you have a slight elevation of the blood pressure for years, that would increase the risk of heart disease, for example. Okay? Checking your weight and height to see, do you have an excess fat mass? Also to counsel the patient to start losing weight. Blood test, we can check in the blood test many important things. For example, HbA1c, that I said, the average of blood glucose. Fasting blood glucose can be checked. Cholesterol and triglyceride, because these numbers would tell me what's the risk of having heart disease. Okay. If there is increased mortality, increased morbidity, what we call it, of increase the prevalence of other diseases, then the many things can be done with a simple blood test. Okay. Plus, if there is a visit to the clinic or to the office, then we can do for example, blood pressure and checking the weight and height. And these simple things can be done without, going for farther and farther investigations.
Okay. So many patients would hear a term like fasting glucose, A1C, post-meal blood sugar. Yes. Can you explain to me the difference between these?
Yes. See, we largely depends on the HbA1c, because as I said, it's an average of blood glucose over the last 3 months. Okay. Then, if it's high, means you have this problem for 3 months, let's say, at least. But if you wake up this morning with a fasting blood glucose a little bit elevated, maybe tomorrow if you sleep well, the blood sugar will be a little bit better. I'm not talking about the diabetes. I'm talking about if you don't have diabetes, if your blood sugar now 101 milligram per deciliter, it's borderline. I shouldn't, scare my patient. You have pre-diabetes now. Okay, we can check it once again and see. If that goes back to normal, maybe, okay, that's something transient, okay? Then fasting blood glucose, also very informative, as I said. If it is below 100, very good, milligram per deciliter. If it's between 100 and 126, that's what we call it impaired fasting glucose. Means the body is struggling to keep the blood sugar overnight below 100. Okay, maybe the liver is a bit scared and start to producing more glucose to the bloodstream, or the pancreas is inefficient to keep the insulin level in a good way to keep the blood sugar. Then fasting blood glucose can be considered as a measure to diagnose diabetes and pre-diabetes also. Now, what we call it postprandial or post-meals blood sugar, most of the people with pre-diabetes and type 2 diabetes in early stages, they will have a spike of the blood sugar after meals, specifically if it is unhealthy meal, as I said, with lots of sugar and, carbohydrates, refined sugar and other things. Then we can have an idea, okay, if your fasting blood sugar is fantastic, that doesn't mean your blood sugar after meals is normal. Okay, then that's why we need to check both of them. Now, this is, for example, one of the points I discussed with my patient. If your HbA1c is elevated, okay, then you have diabetes or pre-diabetes. But doctor, my fasting blood glucose is normal. Then why my HbA1c is high? Because your blood sugar after meals is high. Okay. Then careful about your meals. Probably you're not doing the right thing when you eat.
So that's maybe where you can change those results just by changing your diet, because you won't get that spike after your meal. Correct.
And let's start with the simple steps to probably change the order of your food intake. If you start with the protein, vegetables, then end up with the carbohydrate, that make a big difference. Rather than starting with, for example, let's say if you start your day with a cake and orange juice, then what will happen to your blood sugar? It's very high. But if you have 2 eggs with some vegetables, for example, and yogurt, your blood sugar wouldn't go up.
Okay.
That's simple.
Those are very small changes to make.
Yes.
So which of these measurements tends to give a healthcare provider a broader picture of long-term blood sugar patterns?
The HbA1c. Okay. As I said, HbA1c is the best one to tell us, okay, how's the blood sugar over months. It's not a fasting only one reading.
Okay, and that's the one that the healthcare providers are interested in?
Yes, we will do the blood test. When we request the blood test to see the blood sugar control or diabetes control, HbA1c.
That's okay. And for patients who monitor their blood sugar at home themselves, how do healthcare providers typically determine how often someone should check their levels?
Okay, then this is conflict data about that. Let me simplify. Probably checking your blood sugar more frequent at home would make you a bit anxious. Okay, my blood sugar 150, 140, 130, 120. You try to always think about numbers, okay? Maybe that's not important all the time. Now, recently, we are using what we call it continuous glucose monitoring. I'm not sure if you've seen people
with the button.
A button on their arm, and that's connected to their phone. And that device will check the blood sugar every minute, okay? Now, these days, we try to check the blood sugar through these devices just to improve the nutrition, for example. To understand, okay, is this meal good for you? What's happening to your blood sugar after that meal? Then you have a continuous glucose monitoring, okay? If you are convinced that, okay, I'm not going to panic when seeing these readings, but at least I will look at that after 2 weeks and see how things going on, that will be fine. But if you look at those like numbers and you try to panic, probably that will make you a little bit more anxious. Then try to rely on the HbA1c advised by your doctor. But with a continuous glucose monitoring, or even if you check the blood sugar by the glucometer, the traditional way, you check a blood sugar in the morning, for example, the finger prick, and after meals. Then we look at numbers, for example. If you have already diabetes, we shouldn't keep the fasting blood sugar more than 100 to 120.
Okay.
This is a figure. If you have diabetes, you shouldn't have 2 hours after meal blood sugar more than 140 to 160. Okay, then if more than that, then your blood sugar, it's really quite high. Then you need to consult your doctor to probably provide a new medication or add medication if you are already doing the lifestyle measures.
And that's if you've already been diagnosed with diabetes.
Yes, correct. I mean, see, I'll tell you frankly, continuous glucose monitoring is not a common practice or advice to tell the patient with type 2 diabetes.
Okay.
Type 1 diabetes, which is a different story, where you have insulin deficiency and you need to inject yourself with insulin 4 times a day, or you have an insulin pump, then continuous glucose monitoring is a must.
Okay.
Why? Because the risk of low blood sugar, the risk of very high blood sugar. But in type 2 diabetes, if your healthcare provider advises you to check your blood sugar at home, ask your healthcare provider what readings are expected after meals and before meals or fasting, just to avoid that anxiety.
Okay, so it's very clear that everybody is different and every situation is different.
Yes.
So for somebody who doesn't have pre-diabetes or doesn't believe they have, you could still use a glucose monitor just to understand your lifestyle, is what you're saying.
This is what, I mean, I would say this is like a precision medicine. It's a modern medicine, okay?
Yeah.
If you go back to some healthcare systems, still they don't believe in that, but I do it.
Okay.
I do it. If you have a family history of diabetes, if you have a high risk of developing diabetes, as we said before, if you are overweight, okay, try to understand your body.
Okay.
Try to understand how your body would deal with the food.
So you can use that as a tool to understand food.
Yes, of course.
It's fascinating, really, isn't it? What are some general warning signs or patterns in readings that may indicate that you're taking those readings, but maybe you should contact your healthcare provider? At what point do you contact a healthcare provider?
See, I think hypoglycemia or low blood sugar is a very dangerous situation.
Okay.
And that happens only if you have diabetes, I would say medicated diabetes. You take medication and that some kind of medication will drop the blood sugar significantly. Now, there are symptoms of the blood sugar, low blood sugar, I mean, like, sweating, shaky hands, feeling sleepy or tentative sleep. Then you check your blood sugar. If your blood sugar, I would say below 60 or 50 milligram per deciliter, you should run to the hospital.
Okay.
That's an emergency situation.
Yeah.
Now, high blood sugar, I would say, if your blood sugar is always more than 180 milligram per deciliter as a patient with diabetes or living with diabetes, consult your doctor.
Okay.
Because things could be better.
Okay. So if it appears out of the ordinary,
it's not necessarily to be a dangerous situation at that, but yes, try to seek a medical advice because management could be better.
Okay. Today, many patients are also using telehealth services to stay connected with healthcare professionals. From your perspective, how can telehealth help older adults to stay engaged with preventative care and monitoring?
It's very important. Virtual consultations made, I think, patients' life easier and doctors' life easier.
Yes.
Why? Because many things, as we discussed now, about lifestyle advice, counseling, discussing the blood test result, even sometimes changing the medication if there is like e-script or e-prescription. It can be sent to the pharmacy and the pharmacist, can, dispense that medication based on that advice. Depends on the circumstances that you have. Then I believe telehealth, virtual consultations are very important to improve the lifestyle step by step. And rather than, for example, I'm not going to travel to my doctor now, I'm going to spend miles or driving or whatever, or ride the train, then it's a bit difficult, really, just to sit in front of my doctor and listen to advice. Okay, you can give me that advice through a phone call or telehealth, correct? It's much easier, because we're not going to do any surgical intervention or operation here. We're trying just to give advice.
Yes.
Then please don't be hesitant to go for telehealth because it's very important and easy to practice.
So with telehealth, your patient could ask the question that they want answered without even leaving home.
Same,
Yeah.
correct. The same, things that can be done at the clinic can be done behind the screen.
Great. If diabetes is not well managed over time, what are some complications that healthcare providers like yourself aim to prevent in older adults?
That's why I always tell my patients, we treat diabetes not to enjoy good numbers, not to just to see, okay, your blood sugar 100 milligram per deciliter. Oh, fantastic, that's a good job. No, because diabetes has complications.
Yeah.
And we can divide them simply to two kinds of complications. One is called macrovascular, means affecting the big vessels, heart attack, stroke, blockage of the arteries or the blood vessels in the lower limbs.
Okay, all of that's serious. Yeah.
And microvascular, small vessels like eyes, retinopathy, what we call it. Blindness, unfortunately, still is the main, diabetes is the main reason of blindness now in general. Kidney dysfunction. We don't want anybody to end up having, dialysis or renal failure, correct? And nerve dysfunction, where people start having numbness and tingling in their feet, and they end up having, for example, wounds in the feet without noticing it, unfortunately.
Gosh.
With advanced diabetes, people, they can't feel the heat. They can't feel the cold temperature. That they may injure themselves without knowing, and that's into what we call a diabetic foot, where they have at the end amputation, that we don't want that to happen. Then these complications are very scary, really, but in people with uncontrolled diabetes.
Okay.
If you live with diabetes, which is very well controlled, now if we can reverse it, fantastic. But if we can't reverse it, and that's, as I said, no one size fits all. We need to see, okay, if I can reverse it, let's go for that. If you can't reverse it, I should manage it. I should control the blood sugar near normal readings.
So the primary aim is to prevent it. Then the secondary aim would be to reverse it. And the third aim would be to control it.
Control it.
So there's so many different steps that we can try and make.
Depends where I will meet my patient as a healthcare provider. But the advice for the audience, start from prevention. Don't reach the other two
Don't get
steps.
too far down that track. So fortunately, many preventative strategies can help support metabolic health. What are some lifestyle habits that healthcare professionals commonly encourage for older adults?
Once again, physical activity, please walk, be active. Try to have a balanced diet. Avoid processed food, ultra-processed food. Avoid refined sugar, refined carbohydrates. Eat real food in a balanced diet. Probably ask a nutritionist for that. Important.
Okay.
Sleep well. That's very important. And also try to manage stress. Everybody has stress, of course, but we should have the tools to manage that in a good way to avoid affecting our health.
Okay.
Also, that stress management very important. In the diet perspective, also, please don't have soft drinks and other kind of drinks. These with the high calorie drinks are not good. Try drink water, drink low calorie drinks, even juices, for example, just to let you know if you have diabetes. It's not good to squeeze 5 pieces of orange to have 1 glass of juice and throw their fiber. Can you eat 5 pieces of juice?
No.
of orange, sorry. You can't eat 5 pieces of orange, but simply you can drink the juice of 5 pieces of orange in 1 minute. What happened to your blood sugar then? If you have tendency to have diabetes?
It might spike.
Then the simple things can be, done to prevent those spikes and control the diabetes in a better way.
It's very easy to forget that fruit has so much sugar in when it's concentrated in a juice.
Correct. But if you have and this is what we call it glycemic index. We can talk about that in a different opportunities. But the glycemic index means what's the concentration of sugar in that kind of fruit.
Okay.
For example, berries, much better than watermelon or banana.
So we mentioned muscle strength earlier. How does maintaining muscle strength and staying physically active support metabolic health as we age?
As I said, if you have a good muscle bulk and good muscle endurance, then the utilization of glucose will be much better. Then wouldn't be glucose floating in the bloodstream. If you have a glucose particles floating in the bloodstream, that would affect the organs like eyes, kidneys, nerves, heart, brain.
Okay.
Then if you have a good muscle bulk and good muscle endurance by strength exercise, that will improve the insulin resistance.
Okay. But
Okay.
As a female, you don't need to be bulky. You just need good
Endurance.
muscle strength.
If you have a marathon runner, he wouldn't have a very good muscle bulk,
Okay.
but he has very good muscle endurance and tolerance.
Okay.
And it's not about bodybuilding,
Okay.
but about also how to use your muscles, and that's we should build it up slowly. And that's not through treadmill or running or swimming. Those are cardio.
Okay.
It's good for the heart health, but we should also focus at the strength exercise at people at age of 50, I would say, 65, of course, and do it, reasonably.
Okay.
In terms of improving your strength. That requires some weightlifting, resistance exercise, push-up, squatting, stretching. Those are good, strategies to train the muscle and improve the muscle bulk and endurance.
So a person of 65 years plus could still start doing some form of weight training,
Yes.
although that's a very odd term because it makes you feel like you want to be a bodybuilder, but maybe just lifting a small number of pounds or kilograms
I think
starting small and just doing it regularly.
I think this is the misconception, as you said. The goal is not to build a huge muscle bulk.
Okay.
There's not the
big
reason.
body.
Yeah, there's not the reason to be a Superman at this age.
No.
The reason is to improve the function of your muscle cells.
Okay.
And those will use the glucose efficiently and will avoid many other diseases. For example, Alzheimer. It's called type 3 diabetes. If you have insulin resistance, the risk of having cognition decline is much higher.
Right.
Then we're talking about insulin resistance is not only about diabetes. Insulin resistance might, apparent in a different ways in the body. And that's why having a good muscle bulk is important to prevent those metabolic disorder. And as you said, start from the level that you are in. If you don't do exercise at all, ask probably trainer, coach, how to include some strength exercise to improve your muscle bulk at age of 65 without injuring yourself. That's important.
Yeah. Yes. Well, it's fascinating to hear how just small steps like this can really improve your aging process. And I mean, how many people who are listening today wouldn't have understood that actually their Alzheimer's, potential Alzheimer's risk can be affected by simply starting a small amount of weight training?
Yes,
I didn't know that.
If you control your blood sugar well, if you know how to use the glucose in an efficient way, of course you will reduce the risk of cognitive decline and what we call it Alzheimer and other diseases.
So many seniors take multiple medications for different conditions. So why is it important for healthcare providers to review those medications regularly when managing metabolic health for a patient?
This is what we call it polypharmacy,
Okay.
And specifically elderlies like to take medications, maybe a friend advice or neighbor advice sometimes, not necessarily the doctor advice. But unfortunately, if the patient visited more than one doctor, if there's no communication between those doctors, you'll end up having 10 or 12 different pills, for example, to take. Now, it's very important to look at the drug-drug interaction. Sometimes if you take one medication with the other one, that would increase the side effect of one of them, or they reduce the efficacy of one of them. Then it's very important to look at the timing of taking those medications, the type of the medication. If that medication was prescribed by a different consultant or specialist, please, as a doctor, now not only for patients, communicate, talk to that doctor and see, okay, we can reduce the dose, we can do that. I think in many hospitals, the pharmacists will do a good job of that, because they look at the list of the medications and they warn the doctor, they alarm the doctor, okay, these two medications wouldn't go together. Then, first of all, as a simple advice, don't take medication without a doctor advice and without showing your doctor your pills, your medications.
And does that mean letting your doctors know the supplements that you might take too?
Yes.
Because so many people buy supplements over the counter.
Yes.
They may not consider that's relevant.
And this is a very, important point to talk. Supplements, not always benign, not always good. If you overdose taking something, even it's herbal, if you're taking other medications, for example, blood thinners with some kind of herbs, not good.
Okay.
That will increase the efficacy of that medication. You may end up having bleeding. Then it's very important to be transparent and show your doctor all the list of the medication and tell, okay, this is prescribed by who and this is prescribed by who. And these supplements, okay, I took over the counter. Yeah. Okay, then still the advice is valid there to change the medication list.
And I guess there's no shame if people have been taking a supplement to come to somebody like you and say, well, look, I thought this would help me. And then can you confirm whether it does or not? Of course.
Don't hide it. Don't hide it. As a patient, you are the master of your health. As a doctor, I'm a teacher, I'm an educator. I can tell you, okay, that can go together or no. Okay, or stop this one or finish this first and you can take this, Good. And this is specifically, as you said, with elderlies, people taking like many medications for many chronic diseases.
Yes, and it's very easy to start some of these supplements, but maybe not stop them when you don't need them, perhaps. That's
correct. You need an advice. You need counseling for that.
Let's talk about preventative care now. Many Medicare beneficiaries have heard of the annual wellness visit, but they may not fully understand what that includes. What is a Medicare annual wellness visit and how does it differ from a traditional medical appointment?
The goal of these visits is not to manage diseases, to discover abnormalities before developing diseases. Then that's very important to attend those visits to find out if you have any hidden medical problems before, as I said, for example, if you have insulin resistance before going to prediabetes, or even if you have prediabetes before going to diabetes, then it's easy to manage it at that level. Then this visit, it would be like a checkup.
Okay.
Even if you don't have any symptoms, you don't have any problems, but the doctor will check your blood pressure, will check your weight, will do your blood test, will counsel you about nutrition, about stress, and all these things. Then if there is, a plan to improve your health, to probably make you living longer but healthier, why not?
Yeah. Well, so the annual wellness visit is really worth attending then?
Of course. Even if you don't have any symptoms. I mean, this is the point. It's not a visit because you have a tummy pain because you have headaches. No, now you don't have any problem, okay, but probably you have at least sedentary lifestyle, correct? Or at least you have a family history of hypertension. Okay, why not? Go and check these things and find out if anything can be done to prevent chronic diseases and its complications.
Well, it sounds like if it's part of your plan, it's well worth having anyway, isn't it?
Of course.
So during a visit, what kinds of preventative screenings or health discussions might be included in that type of thing? Would it be a general assessment of your...
It's usually general assessment. It's a history taking to understand if there's any medication the patient takes, for example, and to avoid this drug-drug interaction, as I said. To talk about the family history, about risk factors, about the lifestyle, to see how the patient is doing in terms of physical activity, walking, nutrition, how many meals, if there's enough protein the patient is taking. Those things are very important, and simple things like checking the blood pressure, checking the weight, doing the body mass index to see the ratio between the weight and height. All these are very simple things, but would have a positive impact on the health in general. If you find any abnormality, it's easy to fix.
Yeah. And if you find nothing, then it's a wellness visit,
Great.
not an
it's
illness
a wellness visit. Correct.
Yeah.
No harm.
How can patients prepare for their wellness visits? just to make the most of your time or to the physician's time at the appointment?
So, I mean, if any medication they take, they should bring their medication with them. Part of this education to tell the patients also, okay, get ready about any family history, for example. Try to be very transparent with your doctor if you have any surgical interventions before, for example. Okay, if you have any chronic diseases there, discuss, without any limits and barriers about your lifestyle, everything there. If you have any questions in your mind, prepare them, write them probably in a simple way in a piece of paper and ask the doctor this question. That might be irrelevant, but it's fine. Ask those questions. And if the doctor is not, the right person to discuss that, he will refer you to somebody else. But these things are simple measures to prepare for the annual wellness visit.
That's very good advice, because maybe as a senior you prepare for all these these appointments, but then when you get there you might forget something important.
Correct.
So maybe just writing it down over the couple of weeks before would allow you to make the most of that annual wellness visit and sort of deliver all the details.
Yes, and you will get the most benefit from that visit.
Some patients may have transportation challenges. How can telehealth services sometimes help support those patients?
Once again, if you don't have any thing requires your physical presence in the clinic, it can be done virtually, remotely. Like as I said, discussing the medication plans, what medication could be changed. If there's any blood test could be done, then that can be discussed also virtually. If you have any concerns or any question to ask your doctor, no need to travel for that.
Okay.
Then transportation is not a barrier anymore to open that discussion with your doctor.
Okay.
That can be done remotely.
Great healthcare is accessible even from home, if needs be. So, before we wrap up, let's do a quick fire round. Just quick answers.
Yes.
One health number or lab value that older adults should understand, even if they're not medical.
Yeah, I hope that I explained well the HbA1c. I think that's an important point, specifically from diabetes perspective.
A daily habit that may have a meaningful impact on their lives.
Walk at least 30 minutes daily.
One warning sign related to blood sugar that people should not ignore.
Frequent urination, going to the toilet frequently.
A common myth about diabetes that you, as a healthcare professional, would like to clarify.
Diabetes is unavoidable. That's a myth.
Dr. Hesham, thank you for joining us today and sharing your insights. And thank you to everyone listening to the MedCare Health podcast. Just a reminder that this episode is intended for educational purposes only and should not replace advice from your personal healthcare provider. If you'd like to learn more about telehealth support for preventative care or preparing for your Medicare wellness visit, you can reach out to the MedCare team for more information. We look forward to seeing you in the next episode. Stay healthy and take care.